You've spent decades saving for retirement. You've watched your 401k. You've tracked your Social Security statement. Maybe you've even mapped out a budget for what retirement looks like. But here's what most people never plan for: the one expense that doesn't show up on any retirement calculator, the one that can arrive without warning, grow faster than inflation, and quietly drain everything you've built in a matter of months. I'm talking about healthcare and long-term care costs. And here's the number that should get your attention right now. The average retired couple may need more than $300,000 just to cover healthcare costs throughout retirement. And that number doesn't include long-term care. So in this video, I'm going to walk you through exactly what Medicare covers, and more importantly, what it doesn't. I'm going to show you the real cost of long-term care, your options for protecting against it, and how to build a retirement plan that doesn't collapse the moment your health changes. Because a retirement plan that only works when you're healthy isn't a plan at all. Let's get into it. Here's the assumption I hear from almost every pre-retiree I sit down with: I'll be on Medicare, so I'll be covered. And I completely understand why people think that. Medicare is a federal program. It's been around since 1965. It feels solid. It feels comprehensive. But here's the reality. Medicare has premiums. It has deductibles. It has copays. And it has very significant coverage gaps. Gaps that can cost you thousands of dollars out of pocket every single year. And when it comes to long-term care, also known as LTC, Medicare covers almost none of it. Now let's talk about why that matters so much. According to research from the U.S. Department of Health and Human Services, approximately 70% of people who turn 65 today will need some form of long-term care during their lifetime. 7 out of 10 people. That's not a small risk. That's the majority. The average long-term care need lasts 2 to 3 years, but many people need care for 5 years, 10 years, or even longer, particularly in cases involving Alzheimer's or other forms of dementia. And the cost? A private room in a nursing home today runs between $9,000 and $10,000 per month in many parts of the country. That's $108,000 to $120,000 per year. Home health aid costs, while lower, are rising rapidly as well. Now here's the part that doesn't show up in the financial projections, and it should. When someone doesn't have a long-term care plan, the burden doesn't just fall on their savings. It falls on their family, spouses, adult children, siblings, people who are suddenly thrust into the role of caregiver, often while managing their own jobs, their own families, and their own finances. A plan protects your money, but it also protects the people you love from carrying a burden they were never prepared for. So let's talk about Medicare, because if you're going to plan correctly, you need to understand what you're actually working with. Medicare is broken into several parts. Let me walk you through each one quickly. Part A covers hospital care. Most people don't pay a premium for Part A if they've worked and paid Medicare taxes for at least 10 years. But there is a deductible, and it resets every benefit period, not every year. That distinction matters if you're hospitalized more than once. Part B covers doctor's visits, outpatient care, and preventive services. Part B does have a monthly premium, and you pay 20% coinsurance after your deductible with no out-of-pocket maximum in traditional Medicare. Part D covers prescription drugs. Premiums, deductible, and what's covered vary by plan. Then you have Medicare supplement plans, also called Medigap. These plans fill in some of the cost-sharing gaps in original Medicare. deductibles, copays, that 20% coinsurance. But here's what's important to understand. Medigap does not cover long-term care. Medicare Advantage plans bundles Parts A, B, and often D in one plan called Part C, sometimes with added benefits like dental or vision, but they come with network restrictions and prior authorization requirements that can create challenges when you actually need care. Now, here's the critical gap I want you to understand. Medicare will cover skilled nursing facility care, but only under very specific conditions. You must have had a qualifying hospital stay of at least 3 days. And even then, Medicare only covers the full cost for the first 20 days. From day 21 through day 100, there's a significant daily copayment. And after day 100, Medicare pays nothing. But here's what most people don't realize at all. Medicare does not cover custodial care. That's the help with everyday activities: bathing, dressing, eating, moving around. The kind of care that most long-term care needs actually involve. If you need someone to help you get through your day, Medicare is not going to pay for it. And one more thing I want to mention for those who are already on Medicare or getting close: your Medicare premiums are not fixed. Higher income in retirement can trigger what's called IRMAA, the Income Related Monthly Adjustment Amount. That's a surcharge on top of your standard Part B and Part D premiums. Smart retirement income planning, the kind that accounts for how your income is structured, can actually help you manage and reduce that exposure. So if Medicare isn't going to cover long-term care, what are your options? Let me walk you through 5 of them. Option 1, traditional long-term care insurance. This is what most people picture when they hear the phrase long-term care insurance. You pay a monthly or annual premium, and if you meet the benefit triggers, typically the inability to perform 2 or more activities of daily living or a cognitive impairment, the policy pays a daily or monthly benefit toward your care. Here's the challenge. Traditional long-term care insurance is a use it or lose it product. If you pay premiums for 20 years and never need care, you don't get that money back. Premiums have also increased significantly over the years as insurance companies misjudged how long people would live and how often they would file claims. And some carriers have exited the market entirely. That said, if you're in your mid to late 50s, still in good health, and qualify medically, a traditional long-term care policy may still make sense depending on your situation. Option 2, hybrid life and long-term care policies. These are life insurance policies that include a long-term care benefit rider. If you need long-term care, you draw from the policy's benefit. If you never need care, your beneficiaries receive the death benefit. This solves the use it or lose it problem. Your money is doing something either way. These policies typically require a larger lump sum payment or higher premiums, but many people find the predictability and the dual purpose nature very appealing. Option 3, fixed indexed annuities with chronic illness or long-term care riders. I want to spend a moment here because this option often surprises people, and it's one that can be a very strong fit for retirees who are focused on guaranteed income. Some fixed indexed annuities allow you to add a chronic illness rider or an enhanced benefit rider. If you become chronically ill and can no longer perform 2 or more activities of daily living, your income benefit can double or increase significantly to help cover the cost of care. There's also a tax advantage worth understanding. Under HIPAA rules, long-term care benefits received through a qualified annuity rider can be received income tax-free. That's a meaningful benefit. And here's why I think this option is worth a serious look. You're not buying 2 separate products, one for income and one for LTC protection. You're solving both problems with a single vehicle. Your annuity grows on a tax-deferred basis, provides you with a guaranteed income in retirement, and gives you enhanced income access if your health changes. That's a lot of coverage in one place. Option 4. Self-insuring. Some people with substantial assets choose to set aside a dedicated pool of money specifically to cover healthcare and long-term care costs. This strategy can work, but it comes with real risks. Long-term care needs can be much more expensive and much longer than anticipated, and inflation erodes the purchasing power of that pool over time. If your care need lasts 10 years at $10,000 a month, that's $1.2 million. Most people don't have a dedicated fund of that size sitting separately from everything else they need to live on. Self-insuring is a viable strategy for the affluent, but it's not a default plan. It should be a deliberate, calculated decision. Option 5. Medicaid planning. Medicaid does cover long-term care. In fact, it's the primary payer for nursing home care in the United States. But Medicaid is a needs-based program. To qualify, you typically must spend down your assets to very low levels. With proper planning, ideally working with an elder law attorney, it may be possible to protect some assets for a healthy spouse or use legal strategies to preserve some of what you've built. But this takes advanced planning. Medicaid has a 5-year look-back period for asset transfers, so waiting until a crisis is not an option. For people who have worked hard and built up savings, Medicaid planning is often a last resort, not a first choice. Now, let's talk about how to actually build a plan together. Because knowing the problem is one thing, having a clear path forward is what matters. Step 1. Know your healthcare cost numbers. Don't just assume Medicare will be affordable. Look at your projected income in retirement and understand whether IRMAA surcharges might apply to you. Factor in supplemental coverage, dental, vision, hearing, and your expected out-of-pocket costs. These numbers can add up to several $100s per month or more, and they need to be in your retirement budget. Step 2. Make your long-term care decision before retirement, not during it. This is critically important. Most long-term care products require medical underwriting. That means your health determines whether you qualify and at what cost. Once you have a serious health event, a stroke, diabetes diagnosis, a heart condition, your options narrow dramatically. The ideal time to plan is in your late 50s to early 60s, while you're still healthy and your premiums or costs are lower. Waiting costs you in two ways: higher premiums and potentially no coverage at all. Step 3. Integrate long-term care into your overall income plan. Too many people treat long-term care as a separate checkbox item. It shouldn't be. It should be built into your retirement income strategy from the beginning. If a fixed indexed annuity is part of your income plan, explore whether a chronic illness or enhanced benefit rider makes sense for your situation. You want an income floor that holds steady and potentially increases if your health changes. Step 4. Coordinate your income strategy with your Medicare costs. If your income in retirement is too high, you'll pay more for Medicare through IRMAA surcharges. Strategic moves like Roth conversions in your early retirement years, using qualified charitable distributions after age 70 and a half, and structuring your annuity income thoughtfully can all help manage your modified adjusted gross income and keep your Medicare premiums lower. This is an area where working with someone who understands both the income side and the Medicare side of retirement planning makes a real difference. Step 5. Protect the healthy spouse. This is one of the most overlooked conversations in retirement planning. A major long-term care event doesn't just affect the person receiving care, it affects the person who's still living at home. still paying bills, still trying to maintain their own quality of life. If one spouse spends years in a memory care facility at $8,000 to $10,000 per month, and the couple's income was dependent on shared assets, the healthy spouse can find themselves in a very difficult financial position. A guaranteed income annuity ensures that a defined, reliable income stream continues no matter what happens. That's protection for both spouses. Let me bring this all together for you. Healthcare and long-term care are two of the most underplanned and most expensive realities of retirement. Medicare is valuable, but it has serious gaps. And when it comes to custodial long-term care, the kind most people will eventually need, you are largely on your own unless you plan ahead. The good news is you have options. Traditional long-term care insurance, hybrid life and LTC policies, fixed indexed annuities with chronic illness riders, self-insuring, and Medicaid planning as a final resort. The right answer depends on your age, your health, your assets, your income sources, and your goals. There's no one-size-fits-all solution here, but there is a right time to make this decision, and that time is before a health event forces your hand. If you're a pre-retiree or retiree who wants to understand how healthcare costs, long-term care, Social Security, and guaranteed income all fit together in your specific situation, please check out the link in the description box below and get the free booklet, Avoid Mistakes in Buying LTC Insurance. And before you go, if this video gave you something to think about, please give it a thumbs up. It helps more people find this content when they need it most. Share it with a friend or family member who's thinking about retirement, because this is a conversation most families aren't having until it's too late. Drop a comment below and let me know, what's your biggest concern about healthcare costs in retirement? I read every comment and I genuinely love to hear from you. And if you haven't subscribed yet, hit that subscribe button and the bell so you don't miss the next video. This is Retirement Security Simplified, where we specialize in turning confusion into confidence, one conversation at a time.